Welcome to topic 7. I'm excited to introduce to you an emergency nurse that decided to specialise in trauma. She is now the clinical nurse consultant of trauma for a region of Sydney. Not only does she have a wealth of experience, but she's also utilised by rural hospitals and urban hospitals for patients that have had a traumatic event and that need advice or need to be transferred into a major teaching hospital. She's also been heavily involved in projects that help reduce mortality in the younger driver. I very much look forward to hearing what she has to say.
The reason I got into nursing, I've been nursing for 34 years now, and I think it was because my older sister went nursing 2 years ahead of me, and I did think it was a career that I would quite enjoy. At that stage, there was no university degrees, it was all done through the hospital, so I thought it was probably a nice thing to learn a career and be paid at the same time. I started nursing in New Zealand, and when I got married I moved to Australia. At that time, nursing jobs over here were very, very hard to get, and so I worked in a nursing home for a couple of years, but felt I needed just a little bit more stimulation, so jobs were a little bit easier then, and then I got a job working in a surgical ward for quite a few years. Had one of my children and went part-time, and then moved to emergency. And I worked in an emergency department for about 15 years and just loved it. I loved the variety, I loved the adrenaline. Obviously loved the people that I worked with, which made such a difference. And while I was there, the job that I'm currently in became available, and it was a new position, and so I could develop it how I wanted it to be, which was great. So I developed a lot of protocols for different hospitals, a lot of transfer of care protocols. I manage the transfer, as I said, of the trauma patients that come into Westmead Hospital. I also make sure that the ambulance service have done the best that they could for the patient, that they've taken them to the right hospital, do some injury prevention, and have just gone from there and still love the job. I started being quite interested in injury prevention for our youth probably when I started this job, because I'd walk into intensive care and I'd see young kids, particularly young boys the same age as my son, who had been in a car crash, that were lying in a bed, ventilated and incredibly unwell. And I thought we really needed to do something about this, because this could be one of my children that were lying there. And so as a team we started what's now called Be Street Smart, which is an injury prevention program that we run for all high schools in New South Wales and the ACT. It started 8 years ago with 400 students. We now get last year we had 14,000 students over 3 days. We've had a total of about 72,000 students attend the forum since its inception, and we're basically educating our youth that they can make smarter choices, be safer on the roads, and just give them some strategies and tips to prevent not only a serious injury but maybe death or a disability that's going to be permanent for the rest of their life. We feel this is really, really important, as these kids think they're invincible and it's never going to happen to them, and unfortunately it does. In my role, it's really important to be part of a multidisciplinary team, and that we are respected as nurses and our opinions and our experience are respected. I run an early management of severe trauma, or EMST, course at the hospital, which is for medical staff who are training, and it's particularly for trauma. They may do it as part of their career, or they may be GPs working in a rural or remote area. And I think as running this, I am involved with a lot of very, very senior medical staff from all around Australia, and it's great to be able to be part of that team. If I had to choose between doing nursing when I first started at a young age or not, or doing another thing, I would still choose nursing as a career. I think it's a great career, it's a great pathway that can take you down many, many different paths, and maybe not in working in a hospital for the rest of your life. There's so many different things that nurses can do, and so many different avenues that they can take. So I think it's a great, if people want to use it as a stepping stone, that's also a great thing. They go into public health, they might go into community, they might go into research. And so I think nursing is a wonderful career.
I hope you enjoyed that interview and it gave you an insight into one of the many areas a career in nursing can take you.